Okay, I just wanted to fill everybody in that we will be recording this. And it will be posted on our website probably within a day or two, if you have any reason to go back and check it out. For those of you that don't know me, I am Nancy Phillips, and I coordinate the Illinois Family Resource Center. I'm going to take my video off because I will kind of be moving around here as I do this, so you can just look at my picture. Today we're going to be doing the family journey from chaos to recovery. This is a webinar similar to ones we've done in the past, but it's really a basic overview in looking at what's going on in families. And as I do this, I want to let you know that I have a real dedication to this because I am that family member of 4 generations. And that's what I bring to this project of the Illinois Family Resource Center that I coordinate. I may have a degree in psychology. I've been certified as an alcohol and drug addiction counselor since 1981. I'm certified as a family partnership professional, but the PLE that I, excuse me, I have had with all the smoke coming down out of Canada, believe it or not, it seems to be affecting my throat lately. And that's what the doctor said he thought it was. PLE, person with lived experience. I'm that family member. I have lived and live currently what we do in this project. So I want to share just briefly with you what the Resource Center does. Here's our website, illinoisfamilyresources.org. We're in the process of doing some changing with this. So if you go on it, I still have some editing to do that'll probably be done by mid-August. We are starting to get it set up so that webinar registrations can be done through the website if you want to. As well as the mailings that we do. And we're just in for some exciting change this year. We're going into our 9th year, and it's time to grow, and it's time to do things a little different, and I'm excited about that. And then here is my email address, which you're more than welcome to use. If you have one of my older ones, they still link in currently. Oops. I want to tell you a little bit about the Illinois Family Resource Center, the goal. It started looking at adolescents and getting families involved, part of a federal project 9 years ago, and it's just kind of evolved as that adolescent project kind of lessened out. The Division of Substance Use Prevention and Recovery through the Department of Human Services said we're going to keep the Resource Center going and see what we can do. And the purpose of it is to help provide information and support around substance use disorders, mental health issues, gambling disorder, and that's really grown with the legalization of gambling here in Illinois. And it's important that we look at that as one of the disorders that impact families so strongly. We provide that information to human service providers, excuse me, parents, significant others, whatever that network is, communities, and through relationships with other state efforts. In the last 2 or 3 years, there's been some really wonderful connections made at the state level. I've been doing webinars for CASA, the court-appointed advocates. I have been working with the Prevent Child Abuse Illinois. They also do a lot of and oversee the Drug Endangered Children of Illinois, that alliance. So we're all networking together to provide a better environment for families, for communities, and for our children. And as you listen to me, you'll probably go, oh yeah, her passion's the kids. But it is. I have a history of having had a daycare center at one point in time. And then I came into this field. This Resource Center is funded through the Department of Human Services, the Division of Substance Use Prevention and Recovery, better known as SUPER. And I have some people kind of go, I think it's exciting because I saw a lot of new names on the registration that I don't know and haven't known. So I like sharing new information. I find that makes me feel like we're getting out to where people can see the impact these things have on families and know that there is recovery and there's things, wonderful things happening in our state that we can pull on and use. We get our information out through a lot of different ways, through website postings. We have a Facebook page. It's not a very big one, so I'm hoping as we bring on an administrative assistant, we can build that. Do webinars. We're doing monthly webinars, and we're probably going to do some special ones this year. I have a couple of projects that I really want to bring in some well-known speakers to actually do, and we'll get all that information out to everybody as we grow. We do technical assistance. The other day I had a Ross council that said, come see us, give us some information, help us do some focus, facilitate. And I did that, and it was wonderful. I love doing that. We can do individualized in-service presentations, either in person or through Zoom, however you want to do it. A lot of the difference between webinars and doing those in-service presentations, webinars are general information. You will find that this is a rather basic one. And all our trainings have CEUs with them, thank goodness. But individualized in-service presentations are like if a specific group, ROS group, or provider, super provider, or child welfare office say we need something more focused, the information focused on what we do, we can provide that. Do a lot of conferences and exhibits. Those come up starting in September. There's already three, maybe four scheduled. And then I have stacks of research information. And our goal is to bring somebody on in the Chicago area. And I find that exciting because this is a statewide program. And even though I have a lot of contacts in Chicago and I've done a lot of work up there and I've worked at the state level before when I worked for Prevention First, we need somebody that's doing that. And I think that we're well on our way for that to happen. And I find that exciting. It means we're growing. What I wish for you today is to really learn about the services, and I just talked about those, become familiar with the impact of substance use disorder, mental health, and gambling on families and communities, discuss the lifestyle changes that are part of the family and recovery community, looking at that because I'm such a believer in, we know that recovery is possible. We know that it happens. And we know that it's out there. I know that because I have a husband that has over 40 years of recovery. And I kept him. Isn't that amazing? I also know that there's the other sad end of it. You know, I grew up with alcoholism in the family. I watched my husband through recovery and family recovery. It's been an interesting journey. I have a son that has a number of years of recovery. I have a grandchild that is still actively using somewhat. I also share that my husband and I are the grandparent that's raised grandchildren. And we did that on 2 different generations. Yes, I've been in this field over 40 years. I fell in love with it when I knew it was time to close the daycare center. So what we're going to do today is really explore what's in your toolbox and what's going on and how we can move forward. I'm hoping that in the next couple of months, we're going to get into longer webinars, like an hour and a half, and do more of the break rooms. But we got to get our technology really caught up to that. I find that there's so much interaction, and I love being able to listen to that and watch that and facilitate that. And we're going to be bringing in more people to help do the trainings too. So if you have any ideas, email me. You have somebody. I think next September, we're going to have someone that's going to do some training on how do you share your story. In other words, we know that people need to be sharing their stories. The recovery navigators and peer support specialists that are being certified now and are coming in through the ROSC, and I'll explain ROSC a little later as we go on for those of you that aren't familiar with it, are asked to share their stories. My certification for family partnership or professional partnership asked me to share my story in order to even be certified. And I have 40 years of stories to tell, but how do you do it? How do you do it appropriately and make yourself comfortable? And I will tell you that everybody in my family has given me permission to share, and or I wouldn't do it. Let's look at the definition of substance use disorder. It's defined as a chronic or relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. And I think that's what we've all experienced in our different roles and different settings. It's considered a brain disorder, and I truly believe that. And how the research has changed since I came into this field and what we know now that we didn't know 40 years ago. And it's thought to be that because it involves functional changes in the brain circuits. And those are involved in the reward, the stress, and self-control. And those changes may last a long time after a person has stopped taking drugs. And when we talk about drugs, we are including alcohol. And I think it's important that people recognize that. Over the years, I have coordinated outpatient services that had 8 different programs under it. I also had worked at the state level for Prevention First for 12 years. And so I've seen a lot of change. I've had a lot of exposure. I've been very blessed. It has been a wonderful journey. And the people that I've connected with have been incredible. But it's nice to know that we have all this information coming to us so that we can make sure our communities and our families are even healthier. Okay, I'm going to have to watch my time. Throughout this presentation, you will see some books that pop up, and when I'm done and when I send certificates, they'll probably go out Monday because I'm on vacation when I finish this. I will also send out copies of the PowerPoint, and you can look at this. This is a really good book to look at the impact on family when it comes to these issues. And we know family has a really important role to play in any kind of treatment and recovery. And that includes substance use disorder and mental health and gambling. In my family, my husband had open heart surgery in his early 50s. And I was very much a part of that. I played a big role in that. I have a son that had surgery a year ago, and we all were connected. It's accepted, but we've had a tendency to shy away from it. And luckily that's changing. A primary challenge that we have in addressing issues is that because of the stigma attached with substance use disorders and the things that we're talking about, because of the embarrassment or the lack of treatment services that people know are available, we've had a tendency to not include families and community needs as much as we could, but that's changing. Now, I say we've always had some family treatment one way or another. I mean, Al-Anon's been out there for years, and I used to go when my husband first went into treatment. But I was very blessed because the Our House that holds the contract for the resource center is also where my husband went to treatment. And that was 40 some years ago. And they called me and said, we hold this little group for family members. Why don't you come and visit and see? It wasn't formal. It wasn't what we talk about as family treatment now, but it was something that started me on this wonderful road of where I am now and where we are now. So it isn't that it's brand new, but how we address it is. The other day I was doing some training with some new people coming into the field, and I said, let's define family. And one person used the word network. And to me, that was perfect, because if you look at what SAMHSA at the federal level calls family, it's anybody that has an emotional attachment or impacts a person's life that may be seeking services or going into services. I thought this is perfect. A family is a network. It's not just your spouse. It's not just your child. It's not just your significant other. It's all the people that you network with. And here we have a person in the middle, and you look at all those linkages, and it impacts. That ripple effect is definitely there. Here's another good book, What Makes a Family. It's a good book for children to start looking at that, because our families get torn apart through all this chaos. I want you to think about what you observe in your role, because I think looking at the registration, we have a lot of variety of roles. And think about the family members that you meet up with in that network. It may be a coworker, it may be a roommate of someone that's in college, it may be your next door neighbor. What are those family members feeling, and what are their behaviors? What are those survival skills? When I think back on some of my survival skills, I'm going, oh my gosh, the stories I could tell and won't. But looking at a lot of the behaviors that we see with families and with people linked to persons struggling with these issues, and how we try and manipulate it and manage it, those are survival skills. It isn't us being crazy, although we're often told we are. It's a type of survival skill. And a lot of the children's behavior, what you see in a classroom, what you see in your neighborhood, what you see even in your churches or your faith communities, those are survival skills. And then how is the family supported by the community? That's really important. I put this up here. This is, out of a lot of trainings I've done. It's from a number of books that are out there looking at that family chaos. These are all different kinds of behaviors that we see. And you'll see a lot of these also resemble symptoms of grief. And grief is a part of this process. Families feel, and I do trainings on that, the whole grief process, and how do you come through it and move forward, depending on the outcomes of the person that you are caring about and is experiencing the issues. But the worry, the fear, shame, maybe protective, you're confused, angry, over-responsible. Sometimes there's even abusive behaviors that come out of that, just from the frustration and chaos you're living with as a family member. Looking at all these different things, loss of fun, sadness, loneliness. To me, one of the biggest things in dealing with someone else's substance use disorder or the other issues going on is the exhaustion. I've learned how to manage that within myself, but I know it's there. And it's still there because I still have a family member that's not in recovery. She gets closer all the time, but she's not there yet. So it's looking at that. Bereavement, depression, isolation, all these things that are out there that make us a little crazy if we're living in that kind of chaos. This is a book that's wonderful by Jerry Moe, who is one of the founders of the National Association for Children of Addiction. Back when it was founded, it was children with alcoholism, but it was changed to Children of Addiction, one of the best national organizations. And I will encourage you to be aware of that. We provide trainings every year for teams that do their Celebrating Families curriculum, which is evidence-based. It's incredible. I know that Skip's on here, and she took a team through that. And how it's used is a lot of different ways in communities, but keep an eye out because we will be looking for teams to go through it this year. We usually do it in the spring. And Jerry Moe was one of the founders of that organization, and he's still one of the top speakers. Jerry, this is a great book. Also, Jerry is the person that is doing the work with Sesame Street, the Sesame and communities, where they have all these wonderful resources for parents and professionals working in about anything that impacts our world and could negatively impact children. He does the one on substance use disorder. Looking at the impact of parental substance use disorders, it's associated with child neglect, with abuse. We know that parents and caregivers with substance use disorder can and has increased the demand of child welfare services. And yet we know in Illinois, every time I go to a meeting where we're with DCFS, they're talking about how they lack staff, just like a lot of our treatment centers are looking for staff the R House it's almost always has an opening for a counselor. It's not the easiest field to be in, but oh my gosh, I wouldn't trade it for anything. In the United States, we know over 8 million children have at least one parent with substance use disorder. And we also know that a lot of that's probably not correct, that it's low because it isn't reported. A lot of people are living in isolation. We know the impact of that substance use disorder. Children are more likely to see and hear more fighting, witness more crime, suffer from more poverty, lose more stable relationships with caring adults. And this all impacts the adults that they're interacting with too. This is information from the National Association for Children of Addiction. And I think that it's important that we stop and think about that. One of the most important things, though, to remember is that parents struggling with substance use aren't bad parents in most instances. A lot of what they're doing is survival skills, or it's part of their disease of addiction. And I have to be careful how I use words because we're really looking at how our words impact the stigma of that. We know that parents love their children. I never saw a parent go through the outpatient services when I was coordinating that didn't love their children. And we had very close contact and did a lot of work with DCFS and the treatment for those parents that were involved in DCFS. And parents love their children. It's just that either they weren't raised to have those skills. We also know that substance use, as this says, hijacks the brain, and that becomes more important than anything. So these are the impacts of substance use in our communities. This came from a workshop that I took, and I love this. I'm not going to go through all of it, but when we look at this, all these things that are listed here also are true of what we see of the adults in the home. Unpredictable home life, potential exposure to illegal activities are there, inconsistent parenting and lack of appropriate supervision, or having the skills to provide that parenting and supervision. Inconsistent emotional responses from parents to children. And then children don't learn how to respond appropriately. If it isn't modeled for them, how are they going to learn? And we know a lot of secrecy about home life. This came through the child welfare and I'll have to look up the name. I'm ready for vacation when I get done here. So it was part of a training looking at welfare workers, and it was done for grandparents raising grandchildren to give them some information. So I think that this was one of the best things that I saw and have seen looking at children. Parental behavior may make the child feel guilt, shame, or self-blame. Oftentimes the parent that's using, or whoever it is that's in that environment, and it happens spouse to spouse, partner to partner. They blame other people for what's going on. And we know that we develop feelings of feeling like you have to be perfect. This is something, as much as I love my dad, and he was a highly functioning alcoholic who died at 53 from it. He had a tendency to make me think I had to be perfect. Of course, I think I am, but I don't. Instead, what it did was it created a lot of feelings of not measuring up. It's oftentimes young people will feel like they have to parent their parent. They take on that role. Mom didn't get up to give us breakfast, so I get it ready for the siblings and make sure that they get to school. Just all kinds of things like that. Difficulty trusting others. Or maintaining a sense of attachment. Looking at all these things, low self-esteem, extreme shyness, or aggressiveness from one extreme to the other. And those are survival skills. How do you survive in that environment? And we know children that grow up in an inconsistent environment, or parents that provide that inconsistent environment. There's resistance to rules or authority, and that's often modeled. Experimentation with or use of alcohol and other drugs. We know not only is it physiologically true that there may be a physical response when they start using, because of the makeup of the body and our how we inherit traits. Social withdrawal, difficult relationships with peers, adults, and elders. But back up to this other experimentation. If you're biologically predisposed because of parental use, and that happens in a large number of people, 2 or 3 times of using can oftentimes trigger that whole process of addiction or substance use disorder beginning. Okay, we got a lot of territory to cover here. I put this in here so that you could have it when you get your copy of the PowerPoint. These are just things that we know and you see in adult children of alcoholics, because all of those children that are growing up in our environment with use in their environment are going to grow into adults. And oftentimes we carry all that trauma and all those issues with us. I think it's important to know in Illinois, this is the last data from Generations United, who really have the best information out there. This is Illinois specific. We talk about there being over 8 million children in homes. Well, we know in Illinois, there's 653, over 263,000 children living in homes where a relative is the head of the household. We know at least 85,000 of those a year ago. This is data that's in the yearly report from Generations United, are being raised with no parent present. They've either been left there and the parent has moved out, or they've been placed there through the court system. There's all kinds of ways that children end up in that. I think that it's important to know that Illinois has a Grandparents Raising Grandchildren through the Department of Aging that provides resources and help for grandparents raising grandchildren. But even that department and the state of Illinois is looking at changing that to kinship, because kinship care is becoming much more prevalent. It isn't just grandparents, it's children being placed with older siblings, it's children being placed with aunts and uncles. In my family, I have a granddaughter that just adopted her year-old niece due to substance use disorder. So she had a year of what would be considered kinship. And it's looking at the issues that are out there. In Illinois, it's almost 72,000 grandparents are responsible for their grandchildren. And this is what's really important: for every one child raised in kin foster care, that means not placed in foster care of the system, but in kinship of some kind. In Illinois, there are 10, and that means that it's recorded, that we know that's happening, that it's estimated that there are 10 being raised by kin outside of foster care, any formal foster care, and that's important. These are 2 good resources if you're working with reunification, if you're working with grandparents raising grandchildren or kin care. It talks about grandkids, but the issues in these books are the same for anyone that's doing that. We know in families where there's substance use disorder, these rules have been around for a long time. Claudia Black is one of the people that's used them most, is the don't talk, don't trust, don't feel. But that's the way we raise our families. That's the way we interact in our families. That's the way we hide what's going on. We don't talk because it's a secret. We don't want anyone knowing what's going on outside the family. And you don't trust because your feelings have been hurt a lot of times. There have been promises that are broken. I was always promised to get a train ride. I didn't get a train ride until I came into this field and took between Mattoon and Chicago a lot. It's those things that happen, so you don't trust. And then you don't feel, you might as well shut down and turn off your emotions because you felt a lot of anger, fear, guilt, and sometimes it just hurts too bad. Those survival skills can be very painful. The other thing in the book called Breaking the Chain, and this was developed by Pam Wall at the time I was working at this says Illinois Prevention Resource Center. It's now known as Prevention First. With a lot of interviews of what was going on at that time in the field, when the Association for Children of Addiction was forming, there were some big conferences held, and Pam interviewed a lot of the top people in the field. And out of that, she generated Breaking the Chain. And with Breaking the Chain, I developed trainings that we did all over the state. And it was looking at the issues that are out there. And it was really before we started looking at trauma-informed care, but this is what it was, looking at if what's going on in our life is not validated, especially if like children go into a classroom and are misbehaving or are withdrawn. If you have someone sitting in some kind of meeting and you see that they seem upset or withdrawn, or some kind of support group, if things aren't validated, if no one believes me that my mom was drunk last night, no one believes me that she was laying out in the front yard, no one believes me that my folks were having a fight, because the people that these children are sharing with aren't necessarily comfortable or don't believe it. So it's not validated. What does someone do with those feelings? If nobody believes me, how do I know I'm safe? How are you comforted? And as far as that comfort, one of the best things you can do is, you may not be able to fix it, but is to let a child know they're not alone, or an adult. That's why we have such big success when we actually get people involved in support groups and in 12-step groups and in groups that are willing to share their stories, that things can change. I've been there. This is how I reached this point. So then things aren't resolved and you don't move on. You carry that trauma into adulthood. And oftentimes that trauma ends up resulting in substance use or mental health issues. I like this. It's just pretty simple, looking at the individual in recovery, attainment of sobriety, adjustment to sobriety, and then long-term maintenance. And the family system, attainment of sobriety is unbalanced, but healthy is possible. They can have their own recovery journey. And if this person never attains sobriety, families can get better. Families can have their own recovery journey and be okay. We look at family works on developing a new system. They work at becoming their own entity and not relying on the person that's impacting the chaos in their life to fix it. They can move forward. And that's one of the best messages that I was told that the Resource Center was to send, is that families, or those people that love and care about people experiencing the issues, can move forward in their own journey and take care of themselves. And then if the people they care about are at a place to involve them in a positive way, they can be on a journey together. And I think it's important that we recognize that. This is another really good book. I do a training on early parenting and recovery. Going to be doing it at a conference here in September before long. And these are some really good books and good resources to look at. Questions the family may ask as you're trying to get them involved in different areas. What's in it for me? Why do I need this information? How will I benefit from it? How can I make use of it in a practical way? How will it help me be a better person? How will it fix my son, my spouse, my neighbor, my grandfather, my child? All these questions run through people's minds as we talk about family treatment. And then whether it's formal family treatment, or it's going to some kind of self-help group, or being involved in some kind of community effort, that runs through your mind. I know, because I've been there. One of the things you might stop and think about is, we know that adults need to know why they should learn something. So if you're wanting to share information about substance use disorder, mental health, gambling issues, to help educate them, to help give them the skills, they oftentimes run it through their mind. I want to know why I should learn that. I want to self-direct. My experience is different than what you're sharing with me. Adults become ready to learn when their life experience situations create a need to know. And that's also true of someone entering their recovery journey from using or from their experiences. It's what life experiences led them, but recognizing that as you try and help people and give them those resources, they want to know why it's important. It's important to take a look at some of the barriers that interfere with family involvement, family history, and decision about taking action. Negative labeling, here we go back to the stigma. And thank goodness we're on a journey of across the whole country of trying to stop the stigma and let people know that it's okay to share those stories and help people move forward. Overlooking family strengths. This is important too. Oftentimes we neglect the cultural or gender implications that come along with family involvement in treatment. Now, how does that fit with their environment? We have to meet people where they are. We can't say you have to come where we are. We have to meet people where they are to help move forward. Families often have a perception of hopelessness, and that's, recidivism is high. We know that. So it often creates a sense of hopelessness. That's why our stories of recovery are very important. Fear of failure, limited access to resources and support. We know that's very true. Limited finances. Also, there's some fear and distrust of the health system. It can get kind of crazy. This is a great book, Everything Changes, Help for Families of Newly Recovering Addicts. It even addresses how do you manage and work with that recidivism and what happens. So what I'm going to challenge you to do right now is to think about a strategy that you might apply in your role. I'm sure I wish that we were where we could just really look at what are the roles that you have as you bring to the table, because like I said, I saw a lot of new people that I'm not familiar with on the registration, and I love that. Whatever your role, I like this model. I think that it's really nice to take a look at. It's from the Center for the Study of Social Policy. And I shared this with the CASA workers because they struggle with how to engage families, understanding why some parents who are facing legal action against their parenthood and may have their children removed, miss appointments, how do they interact? How do they start moving forward? And I think that this is a good tool for any of us. If you're a super provider, take a look at this. If you're, it's just pretty basic, but it's comprehensive in its own way. In every interaction, looking at the start of this, express empathy. We aren't saying sympathy, but to me, that means show respect. When I was coordinating outpatient services, I had a very strong policy with the counselors that anyone that walked in our door, I expected them to show them respect as a human being. They may have really struggled with knowing because we had a lot of legal issues walk in that door oftentimes, and we had a lot of DCFS clients. So sometimes it was kind of hard to separate the person as a human that is struggling with an issue with what the behaviors were. And so being able to do that, to show that respect, you can start to express some empathy. And even if it's just nodding and validating where they are, kind of goes back to that comfort. You may not want to comfort their behavior, but comfort the fact that they're willing to get some help or that they showed up for the appointment, and validate that. Show the comfort and then help them find some resolution. Ask good questions. Ask open-ended questions. Don't ask threatening questions until they appear to be ready for that. That's important. And provide information and resources and perspective. That's what we need to do. And oftentimes that's kind of where relationships may end. But then when a longer interaction lets you develops, whoops, come here back. I hit my, let's go back, come here. There we go. Develop strategies. In other words, you're going to set goals. And if it's a formal interaction, you know, you have specific ways you can set goals, and the way we're expected to through the super criteria. But then you can coach and model and mentor, figure out what your role is, model the way you want to hear people speak, model and coach people in understanding their role, and mentor them if possible. And always lift up successes. Because we know, just like the curriculum that was out a number of years ago for children, catch them being good. In other words, have more positive comments about behaviors and successes than negatives. And then you kind of sandwich that, a positive, a suggestion for change, and another positive. Look at person-centered and family-driven care. You know, we talked about the fact that it's important learning principles and techniques for adults. That's true for children too. If you're working with children, you need to make sure that you use all the learning models, you know, and figure out how they learn and incorporate information, whether it's kinesthetic, whether it's auditory, whether it's visual, what combination of those. I have found over time that one way to keep adults engaged in treatment as family members and stuff was to start doing more interactive stuff. You can't just sit there and lecture and give them the information. How does it pertain to them? Use what's out there, those tools, to engage them and help them apply what you're sharing with them as a family member to the fullest extent. Active listening, you know, empathetic listening, non-judgmental behavior. Your role isn't to be judgmental. And oftentimes that's forgotten, or you aren't aware of your body language. And shared decision-making. Remember, language is important. When I first came into the field and started doing some training, we were very big on using the term dysfunctional family. And even then I cringed because I said, I wasn't dysfunctional. What I did as I was growing up, what I did when my husband was still drinking, basically that was the two that were impacted this feeling in me, is I wasn't dysfunctional. I was surviving. And I had to start thinking in terms of, it was unhealthy behaviors that I was showing. It wasn't dysfunctional. It was unhealthy, and it was survival skills. And I was in a workshop the other day talking about language and how you share your story. And she used an example that I just loved, that if you're looking at a field and you see all this flower tops, well, I won't say flower tops, all these blooms kind of shifting in the wind, and you look at it and you think, oh, that's just a bunch of weeds. That's negative. Or you can think, oh, what a great bunch of flowers. So you're looking at your language and how you switch from a weed to a flower in your form of thinking, and it changes the way you interact with people, and it changes the way you tell your story. I put this in so you'd have it as a resource. It came out a couple of years ago, a really good tool. I know it's been out longer than that, but it was shared, looking at the different environments and the language that it was appropriate to use. And as Ross Councils formed, this was shared with them. So I wanted it to be a good resource for you as you look at your role in interacting with people and the type of language that might be used. It says language matters, but can change depending on the setting we are in. As you're working with people, listen without judging, offer services, educate when appropriate. One of the things that I found is I was doing a lot of in-services early on before the pandemic, and we would talk about what kept families and people out. What I heard was, I've been told not to pester. I've been told not to call all the time. I've been told not to leave those messages. So be careful and be appropriate, be open, make offers that suggest self-help support or that you can help support them, but don't become a pest, because that turns family members off. I saw that happening a lot in some piloting that we did early on with the resource center, looking at adolescent programs and adolescent parents. And some of those says, I'm not coming in again. We've been down this road before. Da, 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 da. Well, I understand that. So you have to just kind of gradually build that trust and do it appropriately and with respect. And another thing is connect to the community. And one example I gave is ROSC. Whole body listening. I gave you this to take a look at when you get the PowerPoint. You can kind of see, we talk about what do you need to do so that it's empathetic listening. It's not disrespectful, and you can engage people. I want to throw in ROSC because to me, it's one of the most important things that we've done for our communities and our families as far as getting well outside of action treatment services. ROSC is now in its sixth. Yeah, this time 6 years ago, this week, 6 years ago, I was sitting at Governor State as part of a statewide group looking at how we could start recovery-oriented systems of care in Illinois. And I was representing families and making sure that we don't leave the families impacted by all these issues out of the planning around our communities. And I've been a ROSC coach for different ROSC groups, but ROSC was defined at that point in time, well, and it still is, because this is a fairly new document that I pulled this from the National Institute of Health. ROSC is defined as networks of organizations, agencies, and community members that coordinate a wide spectrum of services to prevent, to intervene in, and to treat substance use problems and disorders. And it includes other issues around mental health and gambling too. It identifies pathways to integrate partners and family members where appropriate into ROSC, identifying pathways to integrate partners and family members where appropriate into ROSC models holds promise. This was exciting. They said there wasn't a lot of long-term research. ROSC has existed in some other states for a while, but Illinois has a real focus. They would very much like to see a ROSC council in every county, and what the ROSC councils are doing is incredible in Illinois. So if you're in an area that has one, by all means, step up to the plate and be a volunteer, be part of that. ROSC members are there to support community, to build environments that are positive, where the stigma is lessened for people experiencing these issues and the family members. And they look at what steps can be taken to create healthy recovery community to lessen recidivism. So it's really who needs to be at that table as we're working with families. ROSC councils need to be at the table. Faith communities need to be part of that. Providers, child welfare, ideally law enforcement. There's some wonderful connections going on with law enforcement, such as safe passages. Look that up. I don't have time to go through all of those individually, but I do think a lot of the ROSC councils have been able to work with law enforcement for safe passages. Taylorville, Illinois had one of the strongest and earliest ones, and it still does, where someone that's wanting to quit can go into the police station or the sheriff's department, and they will help them get a ride to treatment. They have resources, they have volunteers that they can call as part of safe passages to get them to treatment. And as long as there isn't any open warrant or something out on that person, they will not be arrested on a drug charge. And it's been very successful in a lot of areas. So that's one example. Providing events that are substance-free and are healthy for communities and families, ways to celebrate holidays, those types of things is very important. ROSC councils and their volunteers and community members that are involved may do free laundry day for people that really don't have resources to do their laundry. They may be living on the street. It's looking at how do we get housing? How do we help people find jobs and some kind of income? It's all those things. I'm going to take a real quick peek at the chat. Somebody answered it for me. Yeah, Everything Changes is a really good book. Most of them that I put in here are really good. Another thing that ROSC councils and different groups out of ROSC councils can do, or other community groups that you're working with, whether be they faith-based or some other kind of group, that you can help people that are on that recovery journey, and especially help their children do, is see that these things happen, because we know that resources are slim. We know that parents that are in early recovery have so many demands on their time, especially if they're involved legally. You have to have treatment, outpatient treatment groups. You have to have so many self-help or groups that you meet with as support groups. You have to have a job. You have to take care of your children. You know, there isn't time in the day to do everything that you need to do. And we address that in the parenting and early recovery training, taking a look at some of that. But some things that the community can do, or you as a provider can help work out, is help them get their children to school, to nursery or to school. Help make sure that older children aren't missing school, that they aren't staying at home taking care of things like they may have been doing when there was somebody actively using. Children are taken to all their medical appointments and checkups. That's so important. That there's housing and employment that are addressed, that you as a provider or as a community member can come together and do that. That new parents on the recovery journey are supported in the busy schedule for recovery. How are they going to get to their support groups? How are they going to get to their outpatient groups? You know, and transportation alone can be what keeps them from doing it. I need to put transportation up here in this one too. And it's looking at how do we get community and family networks, that whole system that's around us that's impacted, educated on substance use disorder, mental health, and gambling issues. We can do that, but it means we all pull together. Here's some tools to reframe the what ifs and starting to change our language and helping people think differently, be it their family or the people that they care about. Some other self-care tips you can offer to families, of course, attend your meetings, you know, AA, Al-Anon, Nar-Anon, SMART, Celebrate Recovery meetings. There's a lot of them out there. Attend a family program if you can. And if you're really struggling, if you've had a death in the family because of substance use disorder, get to some grief groups. Take care of yourself. Seek out new activities and skills. Check your emotions. Expect your relationship with the addicted person will continue to be emotional. And another, here's the Celebrating Families, and I wanted to make sure that I send you some information around Celebrating Families and the possibility of attending that training. We will train at least 2 more teams this spring. And they also have called the Children's Kit that is done a little differently, but it's evidence-based and it's through the National Association for Children of Addiction. We're going to be offering training on that too, so that you can impact your communities and you can impact your children and your families in a lot of different ways. I'm going to end with this. And you'll probably hear this oftentimes when you attend my webinars. Tell your story. Shout it, write it, whisper it if you have to, but tell it. Some won't understand it. Some will outright reject it, but many will thank you for it. And then the most magical thing will happen. One by one, voices will start whispering, "Me too." To me, that's the most important message here, is being able to whisper, "Me too." That's me. You're telling my story. One by one, voices will start whispering, "Me too," and your tribe will gather, and you will never feel alone again. This is so important for families and the people that are in that network that are impacted by all these issues. We can start getting rid of the stigma by telling our stories. So what's in your toolbox? Are you just beginning? You still growing? You full of experience? Do you have technical skills? If you do, send them my way, please. I think it's important that we look at those. And I want to thank you. We're right on time. I will be sending stuff out. And I just so appreciate your attendance. And be sure and email me if you have any questions or any follow-up. I'm very fortunate that the rest of this week I get to take care of that baby that I said my granddaughter adopted, her niece. Well, her daycare is closed this week, so I get to spend it with a year-old wonderful little toddler that is a product of this environment, but she's just absolutely phenomenal and nurturing, and I feel very blessed. Thank you all. There will be a survey to follow, and I would really appreciate you completing that. Thanks, everyone.